All right. Thanks for tuning in to another Kickback Science episode. Today we have a very special guest, Dr. Lea Haverbeck-Simon, sitting down with us today to tell us all about how exercise plays a role in cancer. So if I haven't convinced you by now that exercise literally can do anything, this will help contribute to that because cancer is a disease that affects literally everyone has been impacted by cancer. And guess what? Exercise can help prevent or treat it. So thanks for coming on, Dr. Haverbeck-Simon. How are you doing today?
Good. How are you? It's good to see you.
Yeah, excellent. So before we get into it, I want you to share, how the heck you ended up where you're at now, because I think you have a really cool background in terms of you've got a PhD in your second language of English. Yep. So tell us how you got to where you're at.
Yeah. So I'm originally from Germany, and right out of high school, I broke my bone, as it happens. I ended up in the hospital, got really interested in medicine because of that. Didn't get into med school, so I started bio. And I really didn't like it. In Germany, the university I was at, it was mostly plants and maybe animals, but no humans. And so then I really wanted to study abroad, somewhere English. So I applied to the scholarship and I ended up at Central Michigan University for my fourth year. And so I went to this exchange and I could take whatever classes I wanted. So I finally took human anatomy and phys. I was like, oh, finally I can take human classes and all these other fun classes that I got to take. And I loved it and I was really good at it. And also the first exam I took, I got 100%. I was like, no way, never gotten everything correct. I know there were mistakes. And so I went to the teacher or to the professor and he was like, oh yeah, but you set the curve. And so he had to explain all these new terms to me. I could retrospectively, and that was 10 years ago, I could barely speak English. I could understand well, but my spoken language was really not great. And then anyways, he was like, oh, what's your background? And I told him about how I used to be a competitive figure skater. And I really liked biology and human anatomy and everything human. But yeah, that I was just an exchange student. He said, oh, if you keep it up, you can become my TA. So yeah, I kept it up and I became his TA. And he told me about this master's program in exercise physiology. And I was like, wow, this sounds cool. We didn't have that in Germany at the time. Exercise science was really only biomechanics and back pain, knee pain, all these things. Or you become a PE teacher. And so, yeah, he told me about this master's and I got really interested. And he said, oh, you should take human anatomy cadaver class. And then they have GAs, graduate assistantships. And I ended up doing that and I got lucky and went home to Germany to finish my thesis and then got into exercise physiology through that. And I love it because it really combined biology and exercise. Truly, it's the perfect intersect. And I just immediately fell in love with all the content. And as I did my master's, I really got into clinical exercise science, which, coming back, I wanted to do medicine, that didn't work out. And then I realized, through exercise physiology, you can actually work with clinical populations. To me, it was just a little bit more meaningful to work with the clinical population than just focusing on, human performance, how do I get faster and stronger just for the sake of it. I'd like the idea of helping people that are sick or try to not get sick. And in our field, at least, most of the research is done in cardiac patients. Mm-hmm. And so people usually get to take EKG, stress testing, all of those things. And I did that, but I had this cool class called Advanced Cardiac Phys, where one peer was talking about chemotherapy-induced cardiotoxicity in cancer patients. Wow, now this is tying everything together. Cardiac system, cancer patients, cardiac disease, and exercise. And then she told me about the school, University of Northern Colorado, that had this cancer rehab institute that she wanted to get her PhD at, which she didn't do that, but I did. And then I met you and all of our peers, and we got to work at the University of Northern Colorado Cancer Rehabilitation Institute and really get to focus on how we can use exercise for cancer patients And I think you started with humans and I ended up starting with animals. Mm-hmm. So even my master's research and then also my first doctoral research was all animal based. Yeah.
I always tell the story of like, because people ask about my background or randomly will come up and I'll start talking about like doing the animal research and how I didn't like it. And I liked, the human population stuff. And hence now I'm in med school. But then usually I'm like explaining how it's so sad to put these poor animals down. And then I'm like, yeah. And someone I worked in the lab with, she used to hold them and like talk to them as these like rats are dying. I couldn't believe you did that.
Yeah. And I mean, I'm on the same page now. I definitely don't want to do animal research anymore. I paid my dues. I want to say it's important. It's important.
Yeah, I mean, you have to do it.
All the medicine, all the advancements. But I'm past it. I'm now arrived in human research. And even throughout the PhD, I kind of switched to human research. But with that being said, we do get trained working with these animals and how to treat them fairly and ethically, of course, and especially rats. They're so sensitive and you can calm them down. Mice, different situation, but that's okay.
Yeah, I don't like, I can't believe I did it for as long as I did. I don't think I'd ever do it again. But yeah, you're right. I mean, you have to do it. So then after you graduate with your PhD, now you're out at the University of Utah at the Huntsman Cancer Institute. So tell us about that. Like what kind of work are you doing out there? And what is that Cancer Institute similar to the UNC Cancer Rehab Institute?
Okay. No, I can already answer that. And so how did I get there was because I for my dissertation, I worked with human samples, but I didn't necessarily like conduct the whole study. At UNC, the cancer program, it's kind of an established clinical program that has been around for, I don't know, almost 20 years or something. And then, it's set up. And so you have people that participate in it. And we can what I did was take blood samples from these patients before they started the program and afterwards. But it's not like I came up with the intervention, training them per se or something. And then I looked at immune things, right? And so my goal was to go somewhere bigger where they were doing clinical trials, like big in a hospital. And so that's what Huntsman Cancer Institute provides. Actually, the Institute is more focused, obviously, on the research side, and there's so many components to it, a lot of basic science too, meaning, they're doing more cell stuff, more in the dishes, in vitro is what we call it, or animal studies. And then they also do human clinical trials from the institution itself, and then also from other from the industry, like pharma industry, and they're testing their new drugs on cancer patients. But the other component to it is the main hospital. So it's literally Huntsman Cancer Hospital. And it's truly just for cancer patients. I don't know, it's 6 floors, every specialty you can think of. They have a wellness center where cancer patients can get acupuncture and massages and all these additional things to their standard treatment, right? So the wellness center also is the one that houses the exercise program there. It's called the POWER program, the Personal Optimism with Exercise Recovery program. And so that's what I've been kind of working with. And when I was looking for an advisor, so the way it works, you can think of a postdoctoral research position as kind of like a fellowship for MDs. Or the residency when they specialize. So I wanted to really specialize in these clinical trials and what we call exercise oncology, so exercise in cancer. And so I reached out to my now boss, Dr. Coletta, and she is an investigator at Huntsman. And her background, she's not only an exercise physiologist, but she's also a registered dietitian. Mm-hmm. So her specialty is doing lifestyle interventions, exercise, and any nutritional, nutrition is such a big term, or diet is such a big term. So yeah, I got really interested in working with her. When I reached out to her, she was just about to hear back about her funding. And, she has this awesome, great study going on right now that is funded by the National Cancer Institute. And also Huntsman Cancer Institute or Huntsman Cancer Hospital, they're an NCI designated comprehensive cancer center. And so that's a designation you kind of have to earn in terms of what kind of research you're producing and what you're contributing and all, all the standards you have to fulfill. And there's so many across the United States. But yeah, this one, obviously we're in Utah. It's kind of, it's not in the middle of nowhere, but comparatively, it's not East West Coast, not the Midwest. So HCI is actually serving like the Mountain West region, like states like Wyoming, Nevada, Montana, and all these things. So they're serving many people, which is kind of what they're specializing in too. Getting a hold of these people that don't have access to regular care. It's not like there's a hospital everywhere, and especially not a hospital where they know how to best treat you. And I think everyone should realize how cool it is to get treatment for any disease, really, where you go a place where they conduct research, because those people, they really know what's going on and if there are any alternative treatment strategies or what the true best treatment for your case is, rather than, oh, this has been done for 20 years. This is how we do it here. So yeah, there's awesome care.
There was a couple instances in Colorado where, you hear from patients that join these clinical trials. And I mean, some patients were even like moving to the MD Anderson to be a part of a clinical trial for like their cancer. And then they end up like being in remission when it was totally unexpected. And like one particular patient, he was like one of the first to enroll in this clinical trial for his cancer that he was told was terminal. And I mean, he's still doing great. I mean, I talk to him every once in a while, and like,
that's so awesome.
Stories like that where it's, I mean, to be a part of these studies and to be at the, with the people who are at the forefront and like you said, really understanding what's going on, as opposed to like a standard of care when you go see, and nothing against like oncologists, but things in medicine tend to lag behind a little bit if you're not involved in research, because it takes a while for research to catch up. But I didn't realize it was like a 6-floor building dedicated for cancer patients where they can do all this stuff. That's so crazy.
Yeah.
Like, that's awesome.
I mean, most of it is a regular hospital. Like you would think, they have the infusion room and like different levels for these different subgroups. And then of course it's all connected to the University of Utah. Like through tunnels, you could get to the hospital of the University of Utah hospital system, all these things. So it's a really cool setup. Also, if anyone has ever gone to Utah, to Salt Lake City, it's very pretty too. It's on the top of on the side of a hill. It's like you oversee all of downtown and all of the valley. So it's nice. Yeah. And people there, also what I've learned so far, research on the side, but just everyone being so supportive and so friendly to these patients, and how that really makes a difference too. Everyone is just holding the elevator open, like the doors, and like just have a great day, and everyone is talking, and like I feel like everyone who works there really has a smile on their face and trying to make all the patients that come there, obviously for a really sad reason because of cancer, to make them feel better and have them feel supported. And I love that. And that's just, I came there not having expectations, so I really enjoy being there. And it's great.
That's awesome. Positive vibes.
Yeah.
So before we kind of get into the research that you've done and are currently doing, can you give us a little bit of, your elevator talk of what cancer exactly is? Because I mean, cancer, it's such a broad term, right? It's not just one disease, but so like I mentioned at the beginning, so many people have been impacted by cancer, whether themselves or someone else in their life. And it's just like such a, I don't know, like the C word, like no one wants to hear the word cancer. Like it's such a fragile word. And I guess I'm rambling on to basically just ask you to define what cancer is.
Yeah. And it's so true, we work a lot with data, like the number one killer is cardiovascular disease. And that to an extent is like very similar for every person, but cancer, like you said, it's so different. I guess the thing that every cancer disease has in common is that, it's usually consists of tumors, meaning we live, we're healthy, our cells are healthy. And then at some point, if you end up having cancer, some of those cells they transform is what we call it. And they kind of become, they mutate into something that is corrupted and that's malignant or bad. So the tissue, right, and cancer, different types of cancer come from different tissues. For example, breast cancer will come from breast tissue, prostate cancer from prostate tissue, right? It's those cells that become bad, they mutate, they get corrupted, and they form this mass, and they grow uncontrollably. So usually our body is like really good at, maintaining it. It pretty much looks the same. We always hear of like, oh, our cells divide all the time. It's nothing we can see, but it happens. But sometimes there's errors throughout that division process. And, there's what we call some genetic hits or so, where there's so many mutations that the body, its own system to take care of that and oversee that everything's going right, can no longer do that, to the point where those mutations can just go through and we have a malignant cell with the potential to divide endlessly, and also the potential to break through the barriers of that tissue and go to other sites. So that's what we call metastasis, when those tumor cells go to different tissue, right? So if you know someone with cancer and, they tell you what stage they're in, that's kind of, defined based on what the cancer, what it's doing and where it's at and how far it's gone or not. So stage 1 would be when it's still contained kind of in that same tissue, versus stage 4, where it's spread to distant sites, so it's metastasized, and then survival outcomes are much worse. And so at the end of the day, if someone that has cancer dies, it's usually due to metastasis. Like there's barely a cure for anyone who has metastases, although there are newer immunotherapies that for some they end up being in complete remission with like no signs of disease.
Yeah. So, you essentially have this disease that the underlying problem is this uncontrolled growth of cells, and your body's not able to stop cell growth. And then the tumor, so people end up succumbing to this disease because the tumor is impacting that organ that it's growing or growing in. Like, you've got a tumor that's impacting the function of,
yeah, and that depends on the site, right? You always hear from some people that don't have any symptoms, right? A common example is pancreatic cancer, where you don't have any symptoms. It's not really affecting your body until it's too late, in terms of by the time it has already spread. Like then maybe the metastases, they go somewhere where, or the tumors, they grow somewhere in organs, say if they grow in the brain or something, and some people all of a sudden they have a seizure, and then they're going to the doctor because of that, and then they find out they have some sort of cancer. So because it's so different for every type of cancer, the symptoms can be so different, and it can be so hard to find, sometimes, like I said, until it's too late. And then other times, you find it because you have pain maybe in that region. Breast cancer, of course, it's so common in females, although also males can have it, but oftentimes you can feel it, right? So and you're supposed to actually do tests and for preventative purposes, feel around the breast tissue and then see if you have a lump or something. But some people never do that. There's just so many ways. Then I've been working with metastatic prostate cancer patients, and interestingly, every cancer type usually has specific sites that it metastasizes to. Not every cancer goes to the brain, and not every cancer goes to the liver or something. But the metastatic prostate cancer, they usually get bone metastases. And so I just read through someone's file, and they had shoulder pain, just really bad shoulder pain. And it ended up being a lesion in the shoulder blade from the cancer. It was a metastatic lesion. And then sure enough, they did all the, then the doctors obviously knew, red flag, did all the scans and blood tests. And then that correlated with a super elevated PSA level. If you didn't hear of this, prostate specific antigen, but that's one of the few biomarkers we have that's pretty reliable and pretty commonly used, to see if there might be genes of this kind of cancer in male. So this is specific to prostate. We unfortunately don't have that for all of the kinds of cancer. And so there's just so many different kinds, and they all have different treatments, although the main treatments for all of them, or for the majority of them, are chemotherapy, radiation therapy. Then if we have some hormone-based cancers, it could also be hormonal therapy. And then more recently, we have targeted therapy, meaning thanks to mostly animal studies, they found some super small molecule that might play a role in this cancer, that they developed a pill for an infusion, and then that targets this one specific area, this one molecule. And then lastly, immunotherapy has gotten better results, and it's very promising. But yeah, I think the point is that we should emphasize prevention more, which is also why I like exercise, because it is definitely associated with cancer prevention, especially in prostate, breast cancer, colorectal cancer, and whatnot. But then also, what we have to do is treat all the different cancer types, and even the patients specialized or based on their kind of cancer. And it's just so complex. It's just, they're so complex, and it's so frustrating. And I hate it so much, which is why I'm still really passionate about doing the work I do, I think.
Yeah, because it really does affect everyone. Everyone's so different. And then you look into, like you said, it's the chemo, radiation, and other therapies. And like, you look at the data on, all these pharmaceutical companies coming out with these treatments that prolong life in cancer patients. And, I remember when we had cancer biology with Dr. Hoyen, and he showed the graph of like a glioblastoma, which is a fairly poor prognosis cancer. And these companies would come up with these drugs to treat glioblastoma. And for the listeners, it's a brain cancer. And then they'd be like, yeah, it extends life by this percent. And you look and it's like, you're adding like 15 days on average to these people's lifespan. And we're trying to make it seem like that's a big deal. It's like, no, that's not. All this money and attention's going to these treatments that really are not actually making much of a difference. So you're not even making a dent in terms of like how we're treating cancer in some circumstances. Obviously, there are, things like tamoxifen and these immunotherapies that are absolutely life-changing. But there's so much money into this area and not into the prevention, because like certain cancers, like colon cancer, for example, if you were to find a tumor, a colon cancer lesion, you could remove it and cure that patient. That patient would not have cancer. But yet,
like a colonoscopy, you're saying,
and
there's
like
so many voices that are like, you should have this earlier. I don't know exactly where it's at right now. Is it 50 years or something?
Actually, I think it's 45
now. Yeah, it's now you hear so many more stories. The incidence of colon cancer in younger people, like in their early 30s, it's so much higher, to the point where they're like, this would make a lot of sense, because the way this starts is usually you have some polyps in your colon that, like you said, if they're removed, it doesn't have the chance to become cancer. But who undergoes a colonoscopy at 30? No one, unless the doctor tells you to for some reason. But we will see how this unfolds. But
we don't have to go down that rabbit hole of issues in the industry. But so, what we can take this one of a few ways, like what is happening to our physiology with cancer, especially when we're going through treatments, and then how does exercise play a role with that? But also, what is it about exercise that seems to prevent cancer from developing? So like a physical activity and your risk of cancer. And then once you do have cancer, physical activity or exercise when you're going through treatment or even not going through treatment. So wherever you want to start there.
Yeah. So I'm more concerned, and also with my research, about like once cancer is already established. And I can speak a little bit to, how it's prevented, and what I assume are some of the most common underlying mechanisms. And we do have to say that most of that data, of course, is coming from epidemiological studies where they follow lots of people over time. And, you can kind of go in and see what their lifestyle was and then see, okay, people that were active to this extent, they were much less likely to develop this kind of cancer or cancer in general. And I think overall, and we're specialized in some ways, but throughout our PhD, we've talked about how exercise is just so good as medicine, right? It's like the one magic pill that people are sometimes too lazy to take. And I guess it would be important to highlight that, we have some exercise recommendation for the general population, like doing 150 minutes to 300 minutes of exercise a week and then resistance training twice a week, and how that's important to maintain function, especially as we all get older. Everyone's getting older. The likelihood of all kinds of diseases is increasing. And so having that improved function, so exercise maintains your muscle mass, it helps you maintain your bone mass, right? So muscle compared to fat, for example, is a way healthier tissue. It's metabolically active. So meaning it needs more calories. It helps you maintain your fitness, but also kind of your leanness, I guess. So burning more calories, having less fat, having more healthy tissue compared to fat, which truly is like a really inflammatory tissue, secretes a bunch of immune markers that, promote inflammation. Maybe a lot of the listeners have heard of like chronic inflammation, but that's a huge problem with all sorts of diseases, also highly linked to cancer. So having kind of a chronic low-grade inflammation that it's nothing you would necessarily feel just in your body over years, it adds up, right? Also exercise. So exercise is an immune modulator. It is associated with and known to decrease inflammatory markers. So it could help from that perspective. Generally, you can think of it as like maintaining your car, right? Everyone brings it in and like gets a checkup. And then with our bodies, some people go to the doctors, some not, but like you also want to give it an oil change. Like you want to have the body stay fit, right? To have everything function well. And so at the beginning, I said something about genetic mutations. Like there's this whole machinery in our cells, how our cells take care of that, the cell cycle, and that mutations, if there was a mutation that could lead to problems, that we can get rid of that cell, like there's intrinsic processes. And exercise is just so good at like maintaining function or improving function of the body. So like all of these things could be related to, being better at not having cancer. And then I don't know if you're interested, but coming from an immune side, there's another theory just from immunology. And so, first of all, the immune system is your body's defense system, right? And usually we think of it as it's your alarm system. And when you have a virus, especially during COVID, people heard about the immune system all the time, right? There's a virus coming in, and then your immune system gets active and it fights it from within. And then after so many days, you're healthy again. And so the immune system is also one of the first lines of defense against cancer. So imagine, like I said, one of those cells becomes bad. And at the beginning, the immune system is really good at kicking those out, right? So the immune system has kind of an army of cells. They truly are like an army where every different cell type has all these different functions. And so at any given day, we could have mutations in our body, but we wouldn't notice because the immune system has already taken care of it and deleted those or killed those cells, got rid of them. But if there is a lot of mutations going on and there's this really strong cell that just keeps growing, we're going from that elimination phase. So the first thing is immune system eliminates the bad cell. So elimination. But if there's ever a time maybe where the immune system is not as strong anymore, or the bad cell keeps getting stronger and, it starts growing, say a tumor starts growing, At the same time, the immune system is still trying to like fight it, but it can't keep up. So they're both kind of working hard. It's what we call the equilibrium phase, where maybe there's a tumor, but it's not really growing. And then the tumor is really smart. Also, I have to say, the tumor is your own cells. So compared to a virus, where the virus is something coming in from the air, from the outside of your body, super easy for the immune system to find it. The tumor, it's literally your own cells going bad. So it's really, it's a fine line for the immune system to say, hey, this is you. We shouldn't attack you, because if that happens, y'all know it, and that's autoimmunity. So the tumor cells are usually so different when they're mutated that at the beginning, at least, the immune system can still like say, hey, this is a bad cell. But then at some point, it develops so much and it gets corrupted and more corrupted to the point where it tries to assimilate more to the healthy cells, or it turns off some of these cool systems that we have integrated to keep us healthy, to the point where it no longer get recognized by the immune system. That's called the escape phase. And so at that point, the tumor tissue looks so different from that our immune system can no longer recognize it, or it deactivates some part of the immune cells too, which is kind of what a lot of the immune therapies are based off, to kind of make our immune system functional again towards this tumor cell or type of tumor, or whatever it is. But yeah, so, I was personally interested in seeing how exercise can potentially affect any of those three phases.
Yeah.
But since we have been dealing with cancer patients, they're at the point where, it's mostly there's already some kind of immune dysfunction going on thanks to the tumor. And then we have treatment on top of that. And cancer treatment, is so harsh on the entire body too. So
yeah,
it affects it too.
Yeah. The military analogy I love. So it's like you have these different areas of the military, your immune system, and then cancer develops. And then, so a tumor is almost like a spy in the military that becomes corrupt and then is hidden from the military and messes everything up from inside.
Yeah.
Like an old,
totally.
Wow, we could make a movie out of that. Yeah. So do the treatments also suppress immune function? Yeah. Well, of course they do. Yeah. Yeah. That's kind of crazy to think about too, is like, you have this immune system that you're trying to activate to fight off the tumor, but then the treatment is suppressing that immune system. And what does exercise do in the immune system? Like how is exercise impacting the immune system in cancer patients, or even not in cancer patients too? But
yeah. And so I think I briefly said, but the exercise is anti-inflammatory, meaning that usually if you work out once, it has effects, but if you work out chronically, it has kind of more sustained long-term effects. And those are usually considered anti-inflammatory, meaning if you were to draw someone's blood and you look at common inflammatory markers, those are usually decreased. And then looking at cancer patients specifically, and that's actually what I did for my dissertation, there's certain things you can look at for the immune system. Of course, it's inflammatory markers, but then you can look at these different immune cells, like parts of the army, instead of maybe you could think of the markers as like the weapons, if that makes sense. So a lot of these cells, they secrete these markers, and that's kind of their weapons and how they would maybe attack the tumor. And so chronic exercise versus acute exercise, actually a whole thing, because acutely, that's first of all way easier to measure, and then second of all, there is a hypothesis too that we get these long-term effects through the repeated bouts of exercise, and therefore having this acute effect. So what happens acutely is that you would take someone's blood and you measure the amount of blood cells, immune cells before, and you do it right during or right after exercise, and it increases. All of the immune cells, or most of them at least, they go into your circulation. So also maybe it would be important to know that we have our immune cells. So the army is everywhere in our body. So all of these different tissues, maybe you've heard of the lymph nodes. I mean, they're kind of immune houses almost. They like house certain immune cells and whatnot. So we are really good at having the surveillance in our body. And so when you start exercising, a lot of those cells come out from those tissues into your blood. And then a little bit after you stopped exercise, they go back into the tissues. And so it's thought that, once they go into the tissue, they kind of redistribute, and that also increases surveillance, right? Because they get to places that they would have maybe not gone before. And then also after that, they go to places that they maybe wouldn't have gone before. And so in addition to that, it's thought that function also increases. So like I said, every cell has like a NK cell, natural killer cell, for example. Like the name says, it can directly kill a target cell. And so maybe it's better at killing, like having mechanisms that support that killing, rather than a sedentary person that wouldn't exercise. Maybe their NK cells, they aren't as toxic to other cells. So that means, we can also increase function. So if you then add these two together, not only does the NK cell maybe go there, but then also has better equipment, more weapons to kill. Like that's a win-win situation, right? So then that happens over and over again. You have this continued surveillance. Then, honestly, in my opinion, and based on my dissertation data, that a lot of exercise is it focuses on changing the function of those cells rather than the number of those cells, because those things, like I said, it's mostly during acute exercise where they go up and then they go down again. But then we can see different markers on the immune cells. Some of them get tired, and then exercise can like wake them up again, in terms of they were not doing what they were supposed to do, and now they're doing what they're supposed to do again, thanks to exercise. Exercise also increases the blood flow at anytime you work out. You increase the shear stress on the blood vessels. That kind of helps with just general transportation and like angiogenesis, meaning we're building new blood vessels in certain areas. Going back to the tumor, if we have that around the tumor, which we call the tumor microenvironment, that would be really beneficial if we have some well-functioning vessels that can not only transport the drugs to it, which would be great, but then also immune cells that are functioning and can actually target the tumor. And then, I guess there's also the difference between where we look at, I talk about the blood because that's usually in research what we can get easily. But of course, if we talk about cancer, it would be best to look at what's going on in the tumor itself, because yes, the tumor also has a lot of immune cells in there. And exercise could potentially redistribute the cells in there too. So like it can support having some of those cells that really want to destroy the tumor go in. And then we have some what we call immunosuppressive cells, which in terms of cancer, that's really not what we want. We want the immune system to attack that cancer and to attack that tumor and to get rid of it. And so to have the immunosuppressive cells come out of that tumor. And then, thinking about circulation as a proxy for what's going on there, what we really want at the end of the day is exercise to increase anti-cancer cells. So like I mentioned, those NK cells, then there's cytotoxic T cells. So toxic against cells, T cells that can also destroy that. We want those anti-cancer cells to really go up, and then we want cells that help the tumor grow, the immunosuppressive cells to go down. And especially in preclinical models, we have shown that that's happening. And then I think in my dissertation, it wasn't enough people, so there wasn't a lot of, or not enough participants, so there wasn't a lot of statistical difference, but the trends were going in the right direction where, not only on the number, like we had a exercise really promoted an anti-cancer phenotype of the immune system over a pro-cancer phenotype, and that those cells were more functionable. Yeah.
So essentially what you're saying is exercise is not just impacting the immune cells that are fighting off the tumor, but also delivering whatever treatment you're giving to these patients by increasing blood flow. So it made me think of Game of Thrones, because we always try to tie it to Game of Thrones here. so, but I can't for the life of me remember the name of, so past the wall, there's that population of people that are living like amongst the White Walkers that are out there, that they're enemies with the people. Do you know what I'm talking about?
Yeah, but I totally
Gilly
don't
and
know.
Sam, their wonderful relationship developed
Yes.
from, but anyway, so that group
Don't
of
know.
people. So essentially, like the tumor is like the White Walkers, you know, it's slowly just kind of like building up in this area. And then you've got the people at the wall and everywhere else to King's Landing that are there ready to fight off those White Walkers if, you know, they are to make it past the wall. But there's this problem because there's this population of people on the other side of the wall that are making so that, you know, the good guys can't actually go out there and fight the White Walkers because there's, you know, then they're having to fight these people and fight this battle. And the analogy that I'm trying to make is doing a shitty job of, but I'm trying because it's Game of Thrones, is, you know, when you're sedentary, you've got this interference from this group of people that doesn't allow the immune system or the people of Winterfell to do its job. But once you're able to pull those people onto your side, you know, then you've got just the immune system, the good guys, and you don't have any of this suppressive environment impacting the ability to fight off the White Walkers or to fight off the tumor. And you know what I'm saying?
Yeah, I think.
Boom,
Yeah.
we did it. Game of Thrones. The
Yeah,
amount of analogies we've done with that.
I love that. And I mean, exercise does so many things from all different kinds of physiological systems. I happen to like the immune system, and I think it's very powerful, along with the upcoming immunotherapies, you know, and how there's a lot of research now combining these things, exercise and the delivery of not only immunotherapy, but then also other therapies and how the efficacy increases. But yeah, circling back, I think it's just not only having these specific effects, but for anyone, especially cancer patients, having exercise as part of their routine, as part of their care, to support function of the body, literal function of the body. If everything, because if the whole body system works better, then everything will be better working, right? So even like maybe how people respond to their treatment. So if it's chemotherapy and we hear all these horror stories and all the fatigue and like the decrease in quality of life because you just feel really bad and terrible and really weak, and being able to sustain that better through exercise and through being fit. And so obviously it helps to do that your entire life, but it's never too late to start, and it's always recommended to start at any time. But especially for cancer survivors, I think there's this huge or cancer patients and survivors, there's this huge, you know, effort to like hopefully eventually have exercise a standard of care for them, but that they know when they go to the doctors, and the doctor will tell them, hey, what's your current exercise levels? And then you should be doing this and that. That would be kind of the goal, from not only from immunological standpoint, from all the standpoints.
Yeah. I mean, that's the idea, right? Is to make it kind of similar to like a cardiac rehab where insurance is going to cover it. We just interviewed Dr. Peter Brubaker at Wake Forest University, and he does a lot of research with cardiac rehab and heart failure patients. And he said that the reason that insurance ended up paying for cardiac rehab is because there's a physician present, and like the physician doesn't do anything really. You know, you're working with the patient as the exercise physiologist, but everything at the end of the day has to be signed off by the physician. And so it's like the payment is because there's physician involvement. And I didn't realize that. And so it's like, you know, you've got oncology rehab. If it's going to be covered by insurance, there has to be some way to involve physicians, which I think is so inappropriate, because it's not like a physician has been trained on how to, you know, use exercise for treatment. But that's just the way our medical system works, is like, if there's no physician involved, then it's just like they're not billing for it.
Wow.
And so people are paying out of pocket, and that's
That'll
such a
be a huge
problem.
barrier. Yeah.
Yeah. And that's such a problem in the field you're in of like, yeah, we're starting to realize how absolutely, I mean, I shouldn't even say starting, like we've known this, the benefit of exercise, but starting to try to like get that information out there to oncologists and to, you know, insurance companies and other practices too, even in like primary care of like, hey, get your patients an exercise prescription just like you prescribe their blood pressure medications. Like they should be prescribed exercise here. But yeah, it's just, I mean, I've been a part of a lot of clinical settings, and it's just your cliche, like a physician's going to say, yeah, exercise is good for you. Go exercise. But what does that mean to the patient? I mean, I've said this analogy on here before of like, you say 150 minutes per week, and that's just what everyone learns. But what does that mean? You know, what type of exercise and what intensity? It'd be the same as, you know, you coming in with elevated blood pressure, and I say, here's this medication to lower your blood pressure. Just make sure you take all these pills this month. Doesn't matter how many pills you take each day. Just make sure that these pills are taken by the end of the month. Like, you don't know what to do. Should I take it in the morning? Should I take it at night? And should it be with food and all this stuff? So yeah, and that's another tangent. Here I go, all these tangents.
Yeah, but it's just so true. And I think it's worth mentioning that, you know, all over the US, at least now, I know in Australia, there's so many groups working on this, in the UK. I know even in Germany now, I mean, I see a lot more exercise oncology researchers, and they all want to find not only the best prescriptions you can get, but we have to have the workforce too, right? So in the US, at least, it's usually clinical exercise physiologists that, like you said, worked in cardiac rehab, that are going to be the people that will facilitate that, along potentially with some PTs. And there is the American College of Sports Medicine Cancer Exercise Trainer certification that provides a little bit more robustness and knowledge for maybe personal trainers or exercise physiologists that kind of want to work with cancer patients. But even to get this through, then, like you said, health insurance and like just even the access to these programs. There's definitely a lot of work to be done. But from what I'm seeing, it's very promising. No, there's studies also that are specifically looking at integrating it into a hospital care system, you know, like how it's one thing to get reimbursed by insurance, but also logistically, like how do we get these people to these places?
Mm-hmm.
You know, so cancer patients come in, and then we need to somehow assess them, like, what does this patient need? And some of them might need physical therapy, and some of them might need exercise. And I mean, I personally believe everyone needs exercise, first of all, but then also, how do you connect them, right? So there's a lot of studies, or not a lot, I want to say, but some of them are trying to integrate it into the hospital structure without causing too much effort in addition to what's already going on in the hospital. I mean, there's already so much going on. And if anyone ever gets a cancer diagnosis, that comes with its own complexities. I mean, not only the fear of everything, but then the different treatments and all of these things, and then fitting in exercise somehow in there. That's definitely a challenge. It's not undoable, but I guess, there's recommendations out there. And then there's also there's a Moving Through Cancer, it's what it's called, initiative by the American College of Sports Medicine, where there are directories and whatever for cancer patients that want to learn more about that, and maybe want to find an oncology program, exercise oncology program. There's a lot of telehealth nowadays too, which is amazing. So it doesn't always have to be in person, but you can also do it remotely sometimes. And, you know, it could be supervised, could be unsupervised, and it doesn't always have to be a gym either. And like you said, you know, how do we do these 150 minutes? It doesn't always have to be on the treadmill. Walking, you know, if the heart rate goes up a little bit, and then you go for a walk for 10 minutes and that feels good and enough, then that's a good exercise chunk. And then you just add these in different times of the day. And yeah, I think just finding resources, and then getting somehow to the medical community, like you said, with the doctors, like, well, they know what they need to prescribe. I think what's most important too for cancer patients to hear is that it's safe, because we know exercise is good. We say it about all these things, and yeah, people should exercise. But with cancer, some people are a little bit more hesitant. I feel like sometimes they're kind of worried if it's safe or not. But we know that it's safe, and you may have to modify while on treatment. It's not 150 minutes, it's 90 minutes that's actually recommended of aerobic exercise, but still resistance training twice a week. But just being mindful of, every path is so individual, every side effects are so individual. But it's doable. Yeah.
So when you have a patient who has a certain type of cancer and is getting a certain type of treatment, is the exercise based on what types of side effects they're likely to experience from that cancer and that treatment? And what are like the most common side effects that you're addressing with exercise? And how does exercise improve those specific issues, whether it's cardiac function or fatigue or
Yeah. I want to say the most common one is cancer-related fatigue. I mean, that's kind of across the board with any treatment almost. And then we look at health-related quality of life. I guess that's more of a broad term, how a person is feeling just in generally with their health. We have physical function. And again, physical function, muscle mass is highly related to physical function. So usually, a lot of treatments cause a decrease in muscle mass, or can go along with cachexia, which we lose tissue through cancer. People are getting weaker. And so, maintaining that muscle mass or even building some would be great for physical function. We know of anxiety and depression, or at least anxiety depressive symptoms can be alleviated. I mean, you've dealt with sleep. We know exercise can also affect sleep. And if we know anything about sleep, is that it's really important for any sort of recovery. And so, cancer patients going through these treatments, all of these things, it's really important to sleep too. So I feel like all of those are really important. Then there's some cancer-specific ones. For example, lymphedema and breast cancer patients, really common, that there's really good evidence that exercise is helping with that. And then there's some that's maybe not, we don't have strong evidence, but it's definitely suggested. Bone is another one where we know that the load we get from resistance training on the bones is really beneficial to counteract osteoporosis, even healthy people. So in cancer patients, also very important. But yeah, I want to say fatigue and physical functioning, quality of life are like the main big ones. And that across the board, almost every cancer patient, has some of those symptoms where they're affected.
Yeah. And I always like with the fatigue, in Colorado, whenever we were working with patients, it was, the fatigue is different than your typical fatigue, right? Like it's not a fatigue where you're feeling tired, you take a nap, you wake up, you feel refreshed. It's constant.
Yes.
And yeah, that seems to be what impacts such a large majority of patients with cancer. But yeah, it makes sense, right? How exercise is able to treat that fatigue. Now, do we see these studies where like just exercise alone can decrease tumor size?
We have animal models that showed that. We certainly won't have human models because there won't be a study existing that's just looking at exercise. But yeah, there were definitely, and a lot of them, the ones that I read, were definitely immune related and, exercise alone. And we differentiate between exercise, meaning it's a structured exercise protocol, versus physical activity, where it's just movement, could be anything. But yeah, that in mouse models and even rat models, I believe, but mostly mouse, there were decreases in tumor size when you inject them with tumor cells and then they exercise versus they stay sedentary. And then, what we were interested in was too, like, what does it look like in terms of immune cells? And then we found that, more anti-cancer cells are in the tumor versus pro-cancer cells or immunosuppressive cells. I have this whole other thing about about preclinical or animal studies now too, where I'm like, just like what does it, how really transferable is it? I know for some things it's really, really important, but for other things, I'm just wondering, we're studying all these tiny, tiny molecules, like these pathways in this one mouse model and this one mouse type that's already genetically alterated and like really has nothing to do with like natural life. And these, it's important to have these controlled factors, but really that's so far off of real life.
Yeah.
I'm just sometimes go like, oh my God, does this make sense, this experiment? But I get it. But yeah, I'm really into more of the, what can we do with the measures that we have in clinical populations right now,
Yep.
to really support them. And I feel lucky that we can use exercise. And then currently I'm doing supplementation too, exercise plus supplementation on outcomes in cancer patients, and, see kind of immediate results. I love that.
What
And
supplementation? Like, what do you?
that one is my PI's principal investigator study, and that is creatine monohydrate. Yeah.
And you're seeing positive outcomes that you're looking at with patients supplementing with creatine?
The study is still ongoing. It's a huge study. So I can't speak to that yet, but
Sure.
There's a lot of preclinical evidence, some other studies that, the thought behind it is that we're having that supplement has been used in like the performance population for this really long time. And it's kind of going into that clinical population now, trying to get the same benefits. And creatine monohydrate is known to like increase energy at any given time. So it like helps with power movements kind of. So we're having that phosphocreatine system that kind of replenishes ATP, which is our energy currency. And so for any fast movements, it's really good at increasing power. And it's very well researched. We know it's a safe supplement, doesn't have many side effects, if at all. And so in terms of cancer, it's thought to be, one is fatigue, because we talked about how hard it is sometimes with the cancer-related fatigue for patients to work out. If you can take something that makes you feel a little bit more energized, and it's not like you drink your coffee and you feel energized right away. It's more of, you take a supplement every single day, and then you have longer sustaining benefits, and that's particularly important for like in the muscle. That supplement goes into your muscle and provides energy right there. So in theory, you're able to provide more energy for any certain task right then, and then therefore be able to also work harder, which gives a better stimulus for muscle adaptation and getting those benefits.
Right. Just making sure you can get all the benefits from exercise. There's also, I know, like a growing area of research on creatine in like cognitive function, and even like dementia and such. Like, it's such a hot area of research right now. And you're right. I mean, it's safe. Like, we're not seeing any of these like adverse events. I'm excited for your study to come out then, or for you guys to publish that, because that's interesting. I haven't seen anything in the actual like clinical population. I know Dr. David Hydock at UNC, he was doing a bunch of that creatine work to offset some of the like cardiotoxicities associated with doxorubicin. But that'll be cool to see it actually like in the clinical population. We've hit on a lot, and the big takeaway that I feel like I'm getting from this, and really, I mean, based on like your expertise and your research in the immune system, but like the impact that exercise has directly on immune function, and not just the function of our immune cells, but also the environment of the tumor as well. Like we hit on with like the Game of Thrones analogy. And then not just that, but also the ability of exercise to impact quality of life of the patient, right? And the fatigue, and like you've got someone who gets told they have cancer, and then all of a sudden it's like you have 12 appointments in the next week to deal with this thing that you don't even have time to like cope with it. Imagine what that does mentally to somebody. Then we're asking people to go exercise at that point, right? That's tough, especially if somebody's been sedentary beforehand. So I feel like there's going to be a huge role of behavior change specialists here. And do you guys have those at the Cancer Institute? Like a group of people that are aimed at helping people change behavior and develop habits with exercise?
I don't think so. I know for some like worst cases, they have like social workers. Like if
Mm-hmm.
you know, then you can refer it, but not like a. I don't think there's a standard like would that be psychologist? But I mean, where I'm at, it's like the doctors know about the program, so they can also refer patients to it regardless.
Mm-hmm.
And then, or they refer them to the wellness center, and then the wellness center gives them a brochure of like, we have all these things to do. And then exercise has its own page, you know, and it could be anything from personal training with a cancer exercise specialist to group fitness. So there's, you know, a lot of different options that one could do. But yeah, I hope that hopefully in the future will be part of standard care, and then it's more easily accessible so that anyone, like you said, people who haven't really worked out before can do that, and then targeted or tailored to their needs based on whatever cancer treatment they have. Because it's like, one could argue they could also just find themselves a personal trainer somewhere in the gym. But that, you know, that could backfire in a way where if they're not trained on that disease and like all the side effects it already has on top of the treatment side effects, that they may totally overdo it, or, you know, don't look at the exercise considerations for this vulnerable population.
Yeah. And I won't ask specific recommendations because it's going to be all over the place. But what I do want to know is, are there any types of exercise or intensities or anything that are not safe generally for cancer patients? Like, we just had someone on to talk about exercise with pregnancy. Dr. Cody Strom shared this population of women who we think are at such like high risk with exercise, but the reality is that's not the case. Now, cancer kind of has a similar tone to it. This seems like people view it as a fragile population. What risks are involved for cancer patients when starting exercise? Can anyone, after they get a diagnosis, just hop right into moderate intensity? Is that safe? Is that effective? Should high intensity be used? Is that safe and effective? Are there things that people should be concerned about?
Yeah. I think for moderate intensity, what we talk about, the more aerobic or cardio part of it, we know that it's safe for, you know, people that start from zero, or they start while they're on treatment and they're really fatigued. You can always break it up in little chunks and take breaks as needed. You definitely don't want to overload the system while on treatment, especially. That can definitely have very bad side effects, just aggravate the fatigue and the recovery. You know, what good does it do if you can do one workout and then the patient has to lay in bed for a week because they're so tired and they can't recover? So, I mean, that definitely has to be closely monitored. And then I'm not entirely sure about the state of research right now with high intensity training while undergoing treatment. I know that have been a bunch of studies in like cancer survivors, which usually is referred to as people who have finished their treatments. Sometimes it's everyone in the whole cancer continuum, but I like to use it as, you know, cancer patients, someone still receiving active treatment, and then survivor more so they're finished with their active treatment, might take hormonal treatment, but that can be a little bit more motivating, and, you know, having higher intensities and being done faster rather than having to be on a treadmill or something for 30 minutes at a time. But yeah, I'm not too entirely sure where the cutoff would be. I know that, you know, you wouldn't want to have a patient train at 90% of their estimated heart rate max. There's no way that would be that the benefits would outweigh the risks, I want to say. But then there's some things, you know, considerations. For example, if you have bone metastases in your spine, like you don't maybe want to do spinal twists and stuff like that. So there are some nuances to it where you have to select the exercises based on what type of treatment they have and what symptoms they have and what how the cancer is spread or not. And because it's so complex, you're dealing with a young cancer patient, in their 30s, 40s, 50s, compared to someone in their 70s, 80s, that would make a huge difference in terms of tolerability, like what they can tolerate for intensities and types and of those things. And then, of course, the stage. I mean, if you have maybe a stage 1 patient that is already has a tumor resected and it's done, compared to someone with metastatic disease, you need to treat them completely different and adjust the. So what could be safe for a stage 1 young patient could be not safe for someone with advanced disease or older. I guess that makes sense.
Yeah, it does. And like, that's what makes it tricky. You can't really like provide a set recommendation because it's going to be so different. And you had brought up some resources that patients can use. We'll link to that in the episode for people that are interested in learning more, somebody who is going through treatment or wants to know where to start with that. Because I think that a lot of patients probably do bring up the exercise with their physician. And it wasn't long ago that the thought was, oh, you have cancer, just rest, right?
Yeah.
Right. That wasn't all that long ago. So I imagine that those conversations with their oncologists sometimes probably aren't very productive when they bring it up and their oncologist is not sure where in the area they might have oncology rehab or where to start with it. And so then they kind of get lost to that and don't end up starting exercise. So we'll link to those types of things. But yeah, I mean, you did, how do you provide a set recommendation for them? But it does sound like this is a higher risk population, and it sounds like it does take a little bit more to actually recover. And so you are at risk of overtraining a little bit more. That's good to know. And it's just crazy. The disease itself is so different, organ to organ, person to person, stage to stage. But then you look at what exercise does, and that seems to be pretty standard. No matter what it is, exercise is going to improve it. And I know like there's a lot of data on, you think of like what puts me at risk of cancer, these things called carcinogens, or like, oh, this is a carcinogen, meaning if you smoke a cigarette, that's a carcinogen and it increases your risk of developing lung cancer or other cancers. And obesity seems to be a huge carcinogen. Obese individuals, like you mentioned early on, more adipose tissue, this increased inflammatory environment in your body, and metabolically, you're not healthy. You used the car analogy. You're not taking care of this car and you're making this suitable environment for a cancer to develop. And this is all theory. Obviously, you said the research is all epidemiology with exercise and decreasing risk of cancer. But I do like the idea of that. It makes perfect sense. And I will die on that hill. Like exercise can prevent cancer. I mean, obviously, cancer doesn't really discriminate. You've got kids getting cancer and the marathon runners still getting cancer. It's not like you're not going to get cancer if you exercise. But I'm pretty damn sure you're going to be at a lower risk, right? Because of all the things that you mentioned.
Absolutely.
What are some cool areas of research that you're like, oh, wow, this is going to be sweet, whether it's like cancer treatments or supplements or anything that you're excited for in the field?
Yeah, I think I'm getting excited for the future treatments. So, of course, on the one hand, immunotherapies, they're already out. Unfortunately, like you said, everyone has different cancer. Also, everyone is responding to treatment differently. So, they're always looking for this one cure that works for all of them, and it doesn't. For some people, immunotherapy can be amazing. And they have something called checkpoint inhibitors, which pretty much turns on some immune cells again so they can actually do their job. A really cool therapy, and it's already going on. It's just super expensive and not widely available. Something like CAR T therapy, where you take out T cells, you put them in a dish, you modify them to the point where they recognize tumor cells, your own tumor cells, and then you put them back in. And so you kind of enhanced your own immune system and gave it instructions how to kill the tumor from within. And there's also works about CAR NK cells. So they're using, instead of T cells, they're using the killer cells, literally, put them in, modify them, make them specific to it. And then also sometimes with these immunotherapies, like have them exercise before something, or before they harvest the T cells, they would have them exercise, because that, increases the amount of cells like in the body. I think what's going to be cool, and that's definitely not my type of research, it's more like biophysics, where they like work on the delivery of some of the therapies to the point where it's getting delivered locally to the tumor instead of affecting the whole body, which that's one of the main problems for chemotherapy, right? It's like you get infused, and then it's technically supposed to affect fast growing cells, which is the tumor, but also other cells like hair, for example, which is why oftentimes, people lose hair in that treatment, but then also affects other cells, right? Like cardiac cells. So hence the cardiac issues after chemotherapy for some people. So that, they're working on like vehicles, like delivery systems with like bioengineers, how they can bring the therapy straight to the tumor, avoiding all these negative side effects on the system. I think that would be really cool.
That's crazy. Those like the CAR T and CAR NK cells, that stuff is just wild. Like, you mentioned it's, if the immune system could find that cancer and kill that cancer, you don't have that cancer. And so you're basically
imagine what a clean job that is. Yeah.
Yeah. You're just taking your own immune cells. Yeah. You take your own immune cells, you just beef them up. It's like they go through SEAL training, the military people, and then you put them back in, and now they're Navy SEALs, and they just go in there and kill off the environment. Yeah, the delivery thing, that sounds awesome.
It's unfortunate that for some, not necessarily the CAR T, but any of those immunotherapies, it doesn't really work, or it's not that effective. Mm-hmm. And then also there's some people that have huge side effects. So, there's so much more research to be done. But of course, coming from this exercise physiology kind of side, or this lifestyle intervention side, that if there's any way to support any treatment really with exercise or improving fitness, improving functioning, that's another thing I'm excited about, how we hopefully integrate this more, any lifestyle intervention, to have a person more holistically healthy, to then be able to, combat cancer, maybe the immune system, maybe the other therapies, but generally just have a better response and better outcomes. That's kind of cool. Until we hopefully eventually, find some sort of cure, may it be, genetic, like being able to find like on the smallest level of you can think of, and go into the body and change something. And then, that'd be sometime in the future.
That's the only thing that actually makes sense to me, of like a cure to cancer, right? Everyone's like, oh, do you think we'll find the cure to cancer? Well, that's kind of a weird question, because cancer is not just one disease. It's so complex. But I think if you could detect a tumor cell early on, that's what's going to be the cure. If you can find this tumor cell before it becomes a tumor that has a huge burden, and then you can, whatever the treatment ends up being, to then go target that tumor cell. But the treatment seems to be prevention in this instance, to me.
Yeah, as of right now, unfortunately. But I mean, we've made so much progress just in the last 10 years with all of the immunotherapy. I wonder what's to come in the next 10, 20 years. I think there's going to be some really good stuff. I'm really excited. I'm also very hopeful. And then, in the meantime, help cancer survivors have improved quality of life and function through exercise. Yeah. That's all we can hope for right now, too.
It's pretty darn rewarding. Sounds like some cool vibes out in that area.
Yes. I think it's extra rewarding. It's so, talking to these patients, and I mean, you've worked with cancer survivors, and at the beginning you brought up glioblastoma, and I remember we had a patient at UNC CRI where I think that patient had glioblastoma, was given, I don't know how many months to live, and he ended up living so many years and just coming to exercise and always telling us how thankful he was.
Yeah.
And yeah, I mean, it's just so nice.
Yeah.
Yeah.
There's some amazing stories that have come out of those institutions like the one you're at and UNCCR. I mean, literally life changing. And you just hope that more places like that pop up.
Absolutely.
But thanks to the work that you're doing and all your colleagues are doing in the field to contribute to that, I think that's what's going to do it.
I hope so too. And, once we have more data from our study, and then I'm going to do my independent project that, of course, is looking a little bit more at the immune system, kind of branching off my PI's main study. I'm excited about those results in the future. And like you said, hopefully support that whole mission, somehow generate evidence how great exercise is from all these different areas. We need evidence from all these different areas, and then eventually it will be part of standard of care and available to people. And then there's this whole other component that it's available now, people please make use of it. So this whole other social component, psychological component, and also the talk to the oncologists and the medical personnel, how do we convince people to do that and show them that it's beneficial? Because if I've learned one thing, we can find all the evidence that we want, but if it's not being implemented and not being, used, then what's the point of it too? So it's just always so many components working together.
Yeah.
To make things happen.
I wish there was a course in med school about all these impacts, because it's just crazy. I mean, like the amount of people that we're interviewing that just share these crazy things with exercise that I didn't even really realize. It's like it's never ending. Like you think
Truly,
like,
yeah.
It's insane. And I just wish that it was in med school, because like I say all the time, doctors know exercise is good, but they just don't know how truly good it really is. Yeah. And that's the problem, because it's like, oh, if I recommend a patient exercise prescription, it's just like, oh yeah, good idea. That's all the discussion is. And then it'll switch to like, what other medications can we put them on? It's like, no, I think this particular patient will do just fine just on exercise. But that's not the thought process that most physicians have. And it's a bummer. It's not their fault. It's just like, you don't learn about it.
And that's truly so sad. I remember in my master's, we had an initiative through a professor. He was really, into the American College of Sports Medicine, exercises medicine, like their own initiative. And we were actually going into that 1 week where MD students or PA students, they had like this 1 week where they do all sorts of different classes or presentations. And we actually had an hour of like showing them all the benefits of exercise, for all these different physiological systems. So may it be the heart, may it be the blood lipids or the immune system or your hormonal system, all these things, like what exercise can do. Then we showed them how we can prescribe exercise. And then they had a little case study, like if you had a patient like this, like how would you in 5 minutes or 3 minutes, because no one ever has time, especially in a hospital. Mm-hmm. How do you deliver that and how do you prescribe them that? Yeah. And so if that could be something in med schools, or I don't know, but that's definitely a dream, right? Everyone's so, best, but everyone's so busy already.
I'm putting together these flyers right now that have basically like guidelines for different, it's just basically just pulling from the ACSM, like a flyer basically that you can hand to a patient that'll tell them everything about like how to exercise ideas, and how much they should exercise for like various conditions. Because again, it comes up and it's like, yeah, go exercise, but you don't have time to explain all that, like you mentioned. Yeah. So I'm going to see how these flyers do, because it's like, then you can just hand it to them. They've got the info and can use it.
That'd be cool. That's a good start. Yeah.
Yeah. And then I'm going to call them at like 3 months and 6 months and see, did they actually like do it? Did they stick with it? And like, why?
Yeah. I'm excited to hear about that. If it will be successful, or, see how the real community actually reacts to this.
Exactly. Well, thanks a ton for sharing all this and nerding out with me. Anything that we didn't touch on that you want to make sure we talk about?
Just, doing this for the first time, talking to someone with a limited amount of time, I realized how big of a topic this really is. I mean, we could have a whole episode just about cancer. We can have a whole episode just about exercise oncology, the immune system, all these things. I think at the end of the day, for everyone hearing this, no matter if, I don't think a lot of people from the audience are currently sick, or I rather hope not, but that regardless of any status, health status or anything, that it truly makes a difference if you stay active throughout your life. And, it will be beneficial from so many standpoints, health related standpoints, that if not from a disease perspective, in this case, cancer, that we can convince people to just, be convinced that it is truly useful and that people, wherever they are in their lives, should be active and do something. And it doesn't have to be, like I said, in the gym or something, but just do something for their health to prevent major diseases, or support that at least.
Right.
Yeah.
And then they'll see what we're talking about. I mean, that's the whole initiative of this is like,
yeah, that's why I love it.
Get
I think you do a great job.
Yeah. Thanks. Well, it helps when we get to interview people that feel the same passion. So appreciate it.